Thank you so much. I'm so happy to be here and nervous about following a congressman, but let me just, I was like, I've never done that before. But he did much better than I will at telling you about the urgency, right? These are bills, the bill to repeal the Affordable Care Act and with it radically restructure Medicaid will move probably this week and over the next couple weeks through the House. So the urgency is real, and the action on this needs to be now. And I also want to express the magnitude of these threats. So in Texas, we have over 1 million people who now have insurance through the Affordable Care Act, the marketplaces. And our uninsured rate has declined by over 1 million people too since the Affordable Care Act. So we have friends and neighbors, family members, people in our community who rely on the coverage from the Affordable Care Act, who were uninsured before or who had struggled to get insurance before, and insurance is much more affordable and available to them. The other thing that's going to be done in conjunction with this bill, like I said, radically restructuring Medicaid, and what I mean by that is that Medicaid has a promise to it now. It's a promise of a partnership between the federal government and the state government. And the way that partnership works is that if the state needs to spend $1 on providing health care for our citizens, the federal government spends more than $1. It has a match to it. It's roughly a 60-40 match, 60% from the federal government, 40% from the state government. And so if we have an epidemic that hits Texas, right, and our spending goes way up, the federal government sends in federal dollars to help us cover those costs. And the other promise Medicaid has is if you're eligible, you're gonna get services. There's no waiting lines, there's no waiting lists, there's no caps on enrollment in Medicaid. And that's a really important thing for our seniors, for our children, for pregnant women, is that they don't have to wait if we've got our quotas filled for the number of Medicaid slots. But that's not the future we're looking at with this bill that's going to be introduced this week and start moving this week. It's going to either block grant or per capita cap, or possibly the new term is per enrollee, I think, allotment, per beneficiary allotment. It doesn't matter. All of those different ways to say, we're going to break that promise that if you're eligible, you're going to get help, and that the federal government will be there to help send in federal dollars to match the state dollars. That those two promises will be broken, and that will radically restructure and harm the pillars of our healthcare system with those two things happening. So the other thing I probably should have mentioned at the beginning, the other thing the Affordable Care Act does, other than giving people more affordable health insurance, is it makes families more secure financially and helps us access healthcare. So since the Affordable Care Act passed, the surveys we've seen from people reporting issues with barriers to care, we've seen improvements in all of them. People who report problems paying a medical bill, people who don't have a regular source of care, people who didn't fill a prescription because they didn't have money left at the end of the month or skip treatment. All of the rates of people reporting those kinds of problems have declined dramatically in the last 2 and 3 years. So the ACA not only gives us health insurance or expands health insurance, it expands families' ability to be financially secure and get health care. So the bill that we expect will be introduced this week and start moving, and again, as Congressman Doggett pointed out, nobody's gotten to see the language of it yet, but we've seen some leaked drafts, and all the experts expect that what will be introduced will be similar. It might not be the exact same, but it'll be pretty similar. It's going to tie the ACA repeal and Medicaid block grants or caps together, and it's going to replace the ACA sliding scale subsidies. So right now, with the Affordable Care Act, you can get some help with your premiums, and people who are very low income get the most help, and then that help peters out as you go up the income scale. That ability to target subsidies and help the lowest income the most, that's going to go away in this bill, and there's going to be a tax credit that is based only on age, not on income. It's going to be based on age because they're going to repeal some of the protections that said people who are older don't have to pay more than X times than people who are younger. So they'll raise the cost of insurance for people who are older and then make tax credits that are based on that age instead of income. This will be overly simple. You probably all got it, but let me make it clear that means a family household earning $200,000 a year will get the same help with premiums as a household that's making $20,000 a year, right? So it's not adjusted to make sure that our lower income friends and neighbors and community members can get healthcare, and to make sure the tax credit will fully cover enough of that premium that they can afford it. And that's a huge difference than the system we have today. The other thing they want to do is rely on health savings accounts, or HSAs, as a vehicle to help people save money to pay for their out-of-pocket costs. So another thing the Affordable Care Act does is lower deductibles. For people who are low income in the marketplace, they have lower deductibles, lower copays, because it's not just premiums that are expensive, right? It's the point of service. Healthcare is expensive. And so people who are low income need that help too. So what Congress wants to replace that with are these health savings accounts, letting people shelter more than twice as much money as you can today in those. But these are savings accounts. They're not health insurance, right? And a savings account only has value if you have money to put in it. A health savings account's no different. It's just a savings account. And so if you have money to put in it, it helps you. And if you don't, it doesn't help you. And there's nothing in the bill drafts that we've seen leaked that in any way anticipate funding the health savings accounts for low and moderate income families, right? So it doesn't help them at all. It helps people at higher incomes who get a tax advantage from the HSA, from sheltering some of their money. But it doesn't help low income families unless you fund the HSA, and they're not proposing to do that at all. The other thing worth knowing, did I go over who's in, is pre-existing conditions, and Congressman Doggett talked about that too, is we don't know exactly which mechanism Congress will use to try to help ensure that people who have pre-existing conditions can continue to get health insurance without being denied or charged more. The latest draft we did see, what it required is that if you dropped coverage, you'd have a penalty if you dropped coverage, right? And that penalty would be a 30% surcharge on your premiums for the next 12 months. And that would be very devastating for, again, for a low-income family, a moderate income family, right? To be able to have to pay that much more if what happened was you had your child turn 19 and she aged out of Medicaid, but she didn't have money to get coverage right then. She'd be penalized for the next year. Or if you lost a job, or if you had a job and you got cancer and you were so sick during treatment you couldn't work and lost your job-based insurance, when you come back into the system, you'd be penalized to be paying higher rates. So it's important to know that 27%. 1 out of every 4 of us that is non-elderly in the state has a pre-existing condition, right? Most of us have protection today because we have job-based coverage or Medicare or Medicaid, but if we lost that coverage, we're vulnerable. We're vulnerable to whatever system Congress puts into place. And the one they're eyeing, it looks like, is a system that penalizes us if we don't have constant coverage without taking into the account that it's very expensive for families to maintain coverage through every type of financial challenge or life challenge that comes at them. And I'd say a couple things about Medicaid is that Medicaid in Texas covers 4.5 million people. These are kids, primarily. 3.5 million are kids, kids that live in low-income families. And they rely on Medicaid to go to the doctor when they're sick and to get immunizations to stay healthy. And the other categories of people that are covered in Medicaid are low-income pregnant women, disabled seniors, a handful of parents of our kids that are on Medicaid, elderly who are in nursing homes. So everybody in Texas who's on Medicaid is both low income and vulnerable in lots of ways. And so the idea that we're going to block grant or cap or cut Medicaid means we will be hurting vulnerable populations. And just to give you a sense of what the magnitude Congress might be looking at for those cuts, leaders here in Texas think block grants or caps means flexibility, but tied to it, the only reason Congress is talking about those is because they want to reduce federal spending. Inherent in the idea of a block grant or per capita cap is that they will spend less federal dollars on healthcare in Texas and other states. So they're not just giving the states flexibility, they're essentially giving them flexibility to make cuts, right? They're going to give them flexibility, but a whole lot less money. Possibly, 20% less in the second year is what the proposal from last summer looked like. And again, we don't know what this one's going to look like, but it could be significant cuts. And there's only 3 ways to cut Medicaid. You can cut the benefits. So you can say, we're not covering prescriptions. We're not covering mental health. We're not covering well child checks, or you can cut people. You can say, we're not covering pregnant women. We're not covering the aged and disabled. Or you can cut the prices, the costs we pay to healthcare providers. You can cut what we pay doctors and hospitals and nursing homes. And that hurts our communities, our hospitals, our nursing homes, and our doctors, right? All of whom already struggle to accept the very, very low rates that Texas Medicaid pays. So I wanted to give you those details to try to help illustrate kind of the magnitude of what we're talking about here. It has the potential to cause, frankly, great suffering, right? People who will lose insurance, possibly millions of people, we don't know yet, because they're going to move this bill before it's been scored by the Congressional Budget Office, so we know how much it costs, how much it'll raise or lower premiums, and how many people lose healthcare, right? We don't know those facts yet, but it'll probably be millions of people. And it'll definitely, for what my organization looks at, we look at how it affects low and moderate income people. And it looks like it'll be disastrous for people who don't have the means to afford healthcare, out of their pocket, all 100% on their own. So I will also say, just like the congressman did, that this is the time today and in the next few weeks to speak up and talk to U.S. House of Representatives and be sent an action alert, I think it was last night, that has the phone numbers to call to tell them that you don't want the ACA repealed without a replacement that's just as good, covers just as many people, with coverage that's just affordable, and to not cap and cut Medicaid. Because it looks like they're talking about some very, very radical changes, and they're talking about making them on a remarkable, a really quick timeline. So, was that helpful? It's like super depressing. It's like nobody's happy to hear me talk anymore. Sure, I'm happy to take questions. I will. I was like, yes, sir.
This is a personal story. I'm a retired family doctor. I saw Medicaid patients for 22 years, or 34 years I was in practice here in Austin. Finally, at the end of that 22 years, my office manager came to me and said, "Are you aware that every time you see a Medicaid patient, you lose money?" The payment was so low, it didn't even cover my expenses for seeing the patient. So I was basically seeing them not even for free. I was seeing them and paying somebody, I guess the state. And so cutting healthcare, I don't think that's gotten much better in the 3 years since I've retired.
I'm sure it hasn't.
Or the, I guess, 8 years since I stopped seeing Medicaid patients. But cutting payments to healthcare providers will mean that there are fewer and fewer healthcare providers who will actually see Medicaid patients because they'll be losing money every time they do. So this is a terrible disaster for our state, what they're talking about doing.
Yes, sir. I agree with you entirely. I'll repeat it for the folks on Facebook Live, is that we have a retired family physician in the audience with us who let us know that the reimbursement rates Texas Medicaid already pays and has historically paid are below cost for most every provider type. They're losing money to treat low-income families on Medicaid. We haven't had annual or regular updates to what we pay providers in Medicaid for over 20 years. There's been every once in a while an update, an increase, and every once in a while a cut, but very infrequently. It's totally divorced, the rates that we pay doctors totally divorced from what the actual cost of providing the services. And so your point is well taken, is that if we cut deeper into that, because there's so few providers that want to participate in that program today because we don't cover their costs, that it will make, it could make coverage meaningless if people continue to have Medicaid but can't get services from physicians, that will do a lot of harm. And I agree with you. Oh, it's like
we all pay for these very expensive ER visits and when the Affordable Care, I have retired from being an Army social worker and I worked at night at the St. David's ER. And as soon as Affordable Care was cut, I was trying to get everybody on it. Because I mean, people don't realize that when somebody wheels into the ER, and it could be a homeless person who's just drunk or whatever, it's $1,500 or more. You and I are paying. If there's nobody to bill, and so we got some help, and we've also learned our lesson the hard way is when people are housed, they're more likely to take care of their health, and they don't have as many ER visits. And it's just, this is costing us a fortune. And if they cut it back, it'll cost us all more. But somehow we end up picking up the bill. I don't think St. David's Foundation picks up the bill for their ER for unemployment. I think the taxpayers or Bracken or Seton or anyone. And it's just the stupidest planning. I just can't get through it. And I'm not a physician, but I can't imagine what. It's just really crazy.
No, I agree. So I'll sum that up too. It's essentially that the leadership in the state and in the country are often penny wise, pound foolish when it comes to Medicaid, when it comes to healthcare, right? When we harm people's access to being able to go to their family doctor, and it takes a while to develop those relationships and make the shift in your access to healthcare from the emergency room when you're uninsured to understanding how the healthcare system works, because it's pretty complicated. And we've just barely started that piece, right? And then if we pull that back and have millions more uninsured people, what it does is raise costs in the emergency room where people can know they can go for healthcare. And those bills are expensive. They're some of the most expensive in our healthcare system. And you're right, taxpayers pick those up in part because, you know, low-income families or uninsured people go, they can pay a little bit, but they certainly can't cover the whole bill. And so when we make these dramatic cuts, it's often to everyone's detriment to hurt people's access to healthcare.
We promised that we would get Stacey back over to our testing now about it. One more
Oh, yeah.
question.
Yes, sir.
Another comment.
Sure.
When you get your care, I call it the ED. I was an emergency physician for 6 years before I went into family practice, so I call it the emergency department.
Mm-hmm.
If you go to the ED and get your care, you get no preventive care,
Mhm.
and most people wait until they just can't wait any longer
Right.
before they go for care when they don't have health insurance.
Mm.
So that means that breast cancer is farther advanced. I mean, I saw one patient at Bracken ED who came in, his first symptom of his lung cancer was a seizure from a brain metastasis. He had no health insurance, and so he ignored all of it. So
Mm-hmm.
you get no preventive care, so everybody that comes in late, and there's no prevention, and there's no diagnosing things early. It's always late, and that costs 10 times as much as with prevention and early diagnosis. It's just crazy.
I know, I agree with you entirely. Yeah.
Big
So
thanks to Stacey
thank
for
you
that.
guys, I appreciate it.